This is Bill Nelson, Director of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. And today we get to talk about leukemia, visit with our friend Mike Hardon and one of our leukemia experts, Mark Levis. We'll start with Mike. Mike, tell us about Ida Peterson Hardon, how you met her, what kind of person she was, and tell us her story.
Yeah, so Ida and I met in college our freshman year. And I think a good way to describe her was always the life of the party. My in-laws and her whole family tries to describe themselves as people. And I think that's a perfect description of her. Loved spending time with friends and family. We were pretty much dating consecutively from our freshman year through our engagement. And yeah, she was just an unbelievable person who showed a ton of fight, especially with her leukemia diagnosis. Certainly not defined by that, but was an incredible patient and was super caring to other patients who were going through a similar battle as her.
So Mark, Ida had leukemia, a blood kind of cancer. What is leukemia? Why do people get it? How does that work? How do we treat leukemia?
Leukemia is a cancer of the blood, but the word leukemia encompasses a whole bunch of diseases that we call leukemia. There's many different types. Acute myeloid leukemia, which is the kind Ida had, chronic myeloid, chronic lymphoid leukemia, acute lymphoid leukemia, a whole bunch of other ones. Acute myeloid leukemia can occur in patients aged 10 to 90. In fact, I've got a 22-year-old in my clinic and a 96-year-old in my clinic. Both have a diagnosis of AML. There's many different kinds of AML, turns out. 20 years ago, we kind of treated them all the same. Now we're breaking the disease down piecemeal. And it turns out, looking at the molecular wiring of them, there are many different types of AML, of acute myeloid leukemia. The one that Ida had was characterized by a RUNX1 mutation, which is about 8 to 10% of them. But the point is, everybody with AML actually has a different disease. And our treatments have changed dramatically in the 20 years, over the last 20 years, I would say.
So Mike, how did Ida discover she had leukemia, and what was her experience and your experience with her with treatment?
So we found out Ida had leukemia in July of 2020, the heart of COVID, and she was, bruising and very tired. And, she ultimately went to a local clinic on the Eastern Shore of Maryland, and we did not really know at all what was going on. So we quickly realized that it was leukemia, and they flew her to Johns Hopkins, all of which was very chaotic for us, especially in the midst of COVID when nobody was allowed in the hospital. So that was an extremely challenging time. And, I think that our experience at Johns Hopkins as a whole, and especially under Dr. Levis's care, was certainly not a positive thing to go through a leukemia treatment, but there was always a plan with Dr. Levis, and we felt very comforted by his care. And for us both, it was challenging. I mean, Ida was beat up and went through 2 bone marrow transplants or stem cell transplants in the course of 1 year, and was constantly being poked and prodded and, feeling extremely tired, nauseous. And it was obviously very challenging for both of us. And, I think part of Ida's character was to try to be as positive as she possibly could. She documented a lot of her treatment process and posted it on social media, which we've heard was very supportful for some other folks that are going through similar treatments, and heard from a lot of other patients. So, very much a glass half full, silver lining type of person trying to make the most of a terrible situation.
So Mark, you mentioned how the treatment of acute myeloid leukemias has been changing. I mean, half a century ago, when we were starting to get responses, we used drugs that were pretty indiscriminate, and we used them very intensively. They would kill cancer cells. So we tried to get as much of those drugs into people as we possibly could. And it was very difficult therapy to get through. as you mentioned, we don't view leukemia as one disease anymore, many different diseases. But the reason we're thinking about that is that we're now beginning to find targets that we can address in some other way than just to kill everything and hope normal cells grow back. Talk to us about targeted therapies in leukemia.
So 20 or 30 years ago, most patients with a diagnosis of AML died. We were getting survival in 10, 20% at best. As we broke the disease down, we found these different subtypes and we could begin targeting each one. We would find a molecular Achilles heel, design a drug, give the drug, it would work. We started combining these targeted therapies, and treatment 20 years ago was uniformly sort of nuclear therapy. And we have improved our cure rates dramatically. Literally, there are some patients who come in with some of these subtypes now. We say, in fact, I said this to a patient last week, if we can't cure you, we don't know what we're doing with this subtype of AML. So by breaking it down, we've made all this progress using targeted therapy and making the treatment more tolerable, so the 96-year-old might actually be able to tolerate the treatment. The problem is we still have not yet identified or developed targeted therapies for every target. IDA's target, RUNX1, I think is going to be one of the next big ones to be targeted by, call it a large research machinery that's directed at this stuff.
So Mark, Mike mentioned that IDA had 2 stem cell transplants. Historically, those were done as sort of an antidote to this nuclear destruction of all the blood-forming cells in the body. But that's not even how we use those procedures anymore, is it?
No, you're right. We've made them less toxic. Literally, somebody can have 2 of them if the first one doesn't work. But what we're learning now is more essential, or as essential to the stem cell transplant, you need to add the targeted therapy on top of that. And so in the case of IDA, she had 2 transplants that ultimately didn't work. If we had had a RUNX1 targeted therapy to incorporate into that, it seems logical based on how we've done with all the other subtypes that that's the way to attack RUNX1 mutated AML.
Mike, you mentioned how Ida was clearly a remarkable person. In addition to working her own way through treatment, she was doing things that benefit everybody who might encounter this disease in the future, working with the Leukemia Lymphoma Society, sharing her story. How can we best honor her moving forward?
One of the best ways that we can honor Ida is through really a couple different things. I think it's important, as I had previously mentioned, the relationships that she had built through other patients. So trying to figure out a way to connect patients that are going through similar struggles or people that have been through in the past, that was something that really lifted her up in the beginning of her treatment, was communicating with folks in a similar position to her. And also something that made her feel really good is to help other patients, specifically in her age range on the younger side of a leukemia diagnosis, try to help them and try to encourage them to fight the good fight. And in addition to that, I think that RUNX1 is, we knew that we were in for a tough ride when we figured out that was our diagnosis, but through the money that we've raised for IDA's endowed fund to continue to do research, not only on RUNX1, but other leukemia subtypes and mutations, as they can vary in their success probability depending on whatever mutation you get.
So the advantage of having something like IDA's Leukemia Research Fund is it gives us a huge freedom to select specific trials where we can't get pharma or the NIH or somebody interested in funding that mean a lot to these subsets of AML patients. And literally before I came here this morning, I was meeting with one of our oncology fellows designing such a trial. It will be run here. It will make a meaningful impact in a subset of AML. And it's really only through a fund like this that we can have the freedom to do that kind of trial.
So we've been visiting with Mike Hardon and Mark Levis, one of our leukemia experts, talking about leukemia and talking about the heroic Ida Peterson Hardon, her struggles with leukemia, and the fund that's being raised in her memory to support new research to improve outcomes for everyone with leukemia.